Maria, to start, can you give us a quick overview of what HealthReady is and why you started it?
Sure. So, HealthReady is a platform that really serves patients who suffer from rare diseases or rare forms of conditions, i.e., like a rare cancer. And the concept of the platform is first to empower patients in a way that they can use their data to help themselves be found and get involved in clinical research. In a lot of cases with patients of rare diseases and rare conditions, they're often the most hardest to find, and they're the ones least likely to know of trials available to help their condition. And sometimes trials is their last resort. Either it could be a terminal cancer or just for a better quality of life when you have a chronic rare disease condition. So conceptually, the idea is me as a patient, I use my data to help myself be found. And that helps clinical researchers when they're looking for patients in these rare categories. It's actually like an accelerator for them because now they've got validated, qualified data from participants who are willing and interested in getting involved in a clinical trial. So it's sort of, let's say, quote unquote, a nice match.
So, talking to Jim Nasser of ACOR, it sounds like DLT has a big role to play in healthcare in terms of adding trust, transparency, and efficiency, both in patient care and, as you mentioned, in clinical research. What other benefits do you see coming from adding DLT to our healthcare systems?
There are so many places that distributed ledger technologies, DLTs, can really help both the patient side and the hospitals and the clinical research side. So I don't know. I always equate this problem, from a point of view. If you ever been to a hospital, you go into an emergency room, either as a caregiver or for yourself, they ask you all these questions, right? Like what happened, what kind of medicine you take, what prior conditions you have. And as you go from room to room, they keep asking you the same question. So the first intake person took that information. Then you go maybe into another room, they ask you the same questions. Then you get, let's say, admitted to a floor and they ask you the same questions, right? So one time I was in a room as a caregiver, I was helping, my parents, and I was like, God, blockchain could easily solve this problem. Problem is not that the person is taking it in wrong. Sometimes they do. Problem is that everybody's verifying the information from one floor to another. And they even say, I'm checking to make sure it was taken correctly, that there was no mistakes. To me, this is blockchain could fix this. A simple opportunity, right? For even if you have your own digital token with all your health records on it, and you give that information through the DLT, those verifiers, this question would sort of be minimized. Again, humans make mistakes. You can see from your own health records when you try to access them, they have wrong information about people all the time. For me, they have the wrong birthday. For others, they have wrong diseases. I hear these stories all the time. When you're not ill, you don't check your health records, right? Like that's like why are you going to check them until something happens. And then something happens and you're like, oh my God. And to go rectify it at the source is the biggest challenge, which means the hospital system or your doctor's office, whatever it might be. But from a DLT perspective, the ability to share that day in such a way that you know it's verified, you know the provenance of it, as a patient, it even empowers us as patients to access it and transact it. From a clinical research side, it's really important as well when we talk about clinical trials and clinical study design because they're usually working with quote unquote dirty data. Even if they partner with a hospital, again, back to the original point, the patients haven't validated that the information is correct. People make mistakes when they capture information about you. And this is the data that the clinical researcher is using to either do study design or to try to recruit patients into their trials. So the ability for us to use DLT actually serves both sides of the quote unquote value chain, the patient and the clinical research and the clinicians, right? And the idea really what we like about it is that one, it empowers patients and it also gives them the right to privacy and protection. And from the researcher side, we can actually prove the consent and how the data, with the hashtagging and everything, how the data is accurate and, actually approved by the patient to be shared with them. So this gives us an unbelievable opportunity. I think the DLT deployed correctly in certain areas of the health value chain can really address some serious inefficiency and lack of trust in the system right now. It's not a cure for every ill in the system, but it definitely can address some of it.
Fantastic. So, just real quick, why did you choose to use Hedera?
So, obviously working with Jim Nasser, our CTO, he actually looked at many different platforms and he recommended Hedera and all the benefits that he told us about it, me as well. The idea that it was, number one, as a young startup, the idea that it was affordable. Sometimes these platforms can get a little crazy. So one, that was important. The second part was the scalability of it. Right now, we're looking at rare conditions. So we're dealing with targeted, smaller size populations. But HealthReady can actually launch into larger chronic conditions, which means larger sizes of population of patients and larger data sets. Unfortunately, every rare disease causes what we call a comorbidity, which means like you can get diabetes or some other chronic condition as a result of having that disease, which then enables us to say, okay, you know what, better target population of patients, bring more research in, and we need a platform that can scale in order to do that. So I think that was one of the things that was really, really interesting to us. And I thought that that gives us the ability to already think leapfrog ahead in the things that we wanted to do.
That's great to hear. Maria,
Mhm.
what are some of the next steps for HealthReady?
So we right now we have embarked on this really special project for neuroblastoma, which targets, unfortunately, young children with this disease. In the U.S., about 800 children under the age of 5 get diagnosed with this rare neural cancer, and unfortunately, less than 50% of them survive. So the idea here is, again, just alone, childhood cancers are considered rare cancers. But in this category of rare cancer, there becomes ultra rare versions of it. And the ultra rare versions are the ones that are less likely to be patients found or get clinical studies designed for it. So what we're trying to do is work with the parents to like get their child's data in there so that we can actually do algorithms across the data and see where these special rare forms are, as well as help the other patients get into clinical trials. Unfortunately, with cancer, even if you say neuroblastoma, it's not like one type of cancer. There's like already 70 different genetic mutations to that particular one, plus the ultra rare genetic mutations. And each one, unfortunately, has its own trial. So just because you have it doesn't mean you qualify automatically for each trial. Having all this data from the patients and the willingness to participate allows clinical researchers to create further study designs on targeted therapeutics. And this is our goal. It's to really start getting ultimately clinical study design around patients, real world patients based on their real world conditions, rather than saying, I have an idea for a design and I'm going to try to fit patients into this box. This is the mold that we're trying to break, and this is the opportunity that we have and what we're really trying to bring forward in the rare disease and rare condition space.
Maria, I can't think of a better use of DLT. You're
Mm-hmm.
doing a fantastic job. Thank you so much for stopping by and using Hedera to enhance your business and improve medical care in general.
Absolutely. I think Hedera is a great tool for us, and it's really helping us achieve our mission. So we're delighted to be using it.
I'm now posting these interviews of Hedera builders independently to my channel. The community, influencers, and media outlets are free to use this content to spread the word on what's being built on Hedera. Once they're all uploaded, you'll be able to go to my channel and search for whatever topic or team you're interested in to find more information. Or you'll be able to get the most recent Hedera news by watching the latest HBAR weekly update. So check them out.